everyone. This is Medicine Made Easy channel, and today we are going to talk about how to answer a cardiac catheterization data questions with giving examples and explanation. This is a quick video. Please subscribe my channel, and if you subscribe, and then I can think that you have getting some benefit from these videos, and then I can produce more and more videos. And if you subscribe, that will support me also. Thank you. I'll start now. So first question. This is a 20-year-old person with cyanosis. So you read this one. That is right atrial pressure 10-1. And when you saw this one, don't worry. It's very easy to solve. We have draw a small diagram and look at saturation and the pressures. Remember the value 10 and the gap of 10 and value 20 and left side 16 and the right side 8 things. We had a video that is a part 1 of this one. Better to watch that one before watching this further. But I'll give a small summary here also. So the first value 10 is the diastolic pressure in every way of the heart and the pulmonary artery and the right atrium, right ventricle, PCWP, and the left atrium and the left ventricle all will be in the range of 10 except the aorta. Aorta diastolic blood pressure is high. Okay, so that's the first. Okay, even without any calculation we can see if there's any abnormality there. That's the first thing to remember. And another thing is we have to look for the saturation changes. If the saturation is more than 75 in the right side, that is abnormal, and if it is less than 96 in the left side, that is abnormal also. There should be shunting. Okay. Now we are seeing the question again. There are no problem with the diastolic pressure here. Only saturation is significantly low in the left side. It's in the left ventricle level. So VSD is a possibility here with the reversal of the shunting. And the right side, no saturation above the level of 75. Then that's okay in the right side. Only the problem is the left side, saturation wise. Okay? Saturation wise, there is a reversal of the shunting in the VSD with the VSD. Then next, in the previous video, I told that looking for the saturation 10, 10, 20. So first 10 we look at. The second 10 is here, the pressure gap. Pressure gap between the left ventricle to the aorta, if there's a drop more than 10, that's suggesting AS. The gap is between the ascending aorta and the descending aorta, if the gap is more than 10, suggesting of the coarctation of the aorta. If from the right ventricle to the pulmonary artery, the pressure gap is more than 10, suggesting of the pulmonary stenosis. Look at our question. Now you saw it, no? There's a pressure gap of 120 minus 15, so there's a more than 10 gap is there. So pulmonary stenosis is a possibility here. So because of the pressure gap, pulmonary stenosis is a possibility here because of 120 minus 15. There's a now again going back 10, 10, 20. Now looking for the 20 here. 20 what we look for, whether left ventricular diastolic pressure is more than 20, suggesting of left ventricular failure, or PCWP having P wave of more than 20, or pulmonary hypertension with pulmonary artery pressure more than 20. None of those are there. So here pulmonary artery pressure is 15. So not having any pulmonary hypertension here. Okay. Next is look at the left 16. Left 16s are MS, MR, LVF, ASAR, and the coarctation of the aorta. I elaborate more and more in the first video. Please look at that. And in this patient, all are negative. All are normal. No problem in the left side. So believe this is easy. Now we look at the saturation 10, 10, 20, and left side 16. Now we are looking for the right side 8 things. Let's see. There are things here. Right side mainly 4 groups we look at. Elevated right side pressure with we can get right ventricular infarction or the pulmonary stenosis of the tetraradial palate. In the right ventricular infarction, systolic blood pressure will be low, but this patient didn't have any systolic blood pressure reduction. And pulmonary stenosis in the tetraradial palate is a possibility. This patient also had the right side pressure elevation. We can see, okay, and he didn't have any pulmonary hypertension. So pulmonary stenosis or tetraradial palate is a possibility. Okay. Okay, you see, no? There's a right side pressure elevation is there, 120 and 20. Other things we look at in the right side is this one. Equation of the diastolic pressure, it is not there. And systolic pressure equalization, it's there. When we are looking for the VSD, right ventricular systolic blood pressure will be equalized with the left ventricular systolic blood pressure, that is there. And we'll see that first. right ventricular systolic blood pressure is what is that, 120, and left ventricular systolic blood pressure is 120. So VSP is a possibility here. And next systolic blood pressure equalization, our third step was right ventricular systolic blood pressure equalization with the aortic systolic blood pressure. We talk about more and more in that first video. Okay, and there the aorta is arising from the right ventricle line. Transposition of the great artery of the tetralogical palate is a possibility with the overriding aorta. So it's there. It's there. Okay. See, aorta is 120 and right ventricle also 120. So it's also, and the last one we look at in the right side is the pulmonary hypertension. It is not here. So altogether, this patient is having tetralogical palate. With the VSD, we saw the systolic blood pressure equalization in the left ventricle and the right ventricle, and also saturation drop in the VSD level, the ventricular level, suggesting of the reversal of the shunt. And we show the pulmonary stenosis here with the right ventricle to the pulmonary artery. There's a pressure gap, drop pressure is there, and overriding out also we observe with the aortic pressure is equalized with the right ventricular pressure. See, believe it's easy. Draw diagram, look at saturation and pressures 10 10 10 20, and left side 18, then you get the answer. Okay, thank you very much for watching the video. Please subscribe my channel.